I'm about to start my head to toe assessment. This is my patient. I'll start with washing my hands and getting my gloves on. So how have you been doing?
Well,
Are you in good health? How is your health?
it's good.
Do you have any complaints today?
No, ma'am.
Okay, I'll go ahead and start with the assessment. I'll start with looking at you, see how generally you look. I'm looking at your skin, it's glowing. I'll start from the head, like I said earlier. I'm going to be, have you had any trauma to your head recently?
No.
Any lacerations? Okay, I'm going to palpate for such, any lesions, any infestations. I don't see any of that. And then I see your face. I'm going to palpate the features for any tenderness, especially any, brokenness in a form of a crepitus. Like if something is broken and you press on it, you feel, you hear the bones move. You don't have any of that. And then I'm going to go ahead and palpate the temporal artery, which is at the front of the ear, between the tip of the ear and the eye. So, well, it's normal, it's regular. There is no cause for concern, and I'm going to palpate your tonsils. We have 10 of those. I'll start with a pre-auricle at the front of the ear. I'm looking for tenderness. If there is any inflammation, any infection in your body, well, whichever part of the body the tonsils drain, there will be some swelling. So in this case, the pre-auricles, they are non-palpable. I cannot palpate them, so they're not swollen. And when I press on them, you don't feel any pain. So they're non-tender. The post-auricle are behind the ear. I don't feel any swelling, any tenderness on your part. Are they tender? The occipitals right at the back, are they tender? They're not swollen either. The submental right here at the bottom of the tongue, I don't feel any swelling. Do you feel any tenderness? The submandibular, I don't feel any tenderness. The post clavicle, they run down here. I don't feel any tenderness. They're pretty, and they have 2 sets of the clavicles, and I don't feel any tenderness on them. The subclavicle tonsils, I don't feel any tenderness in those either. The other thing I'm going to do, I'm going to ask you to clench your teeth, raise your eyebrows, shut your eyes tight. What happened?
I felt something soft on my left cheek.
And the last thing I need for you to do is to pop your cheeks. Okay, I'm trying to test your facial cranial nerve to see that it doesn't have any abnormality. You are able to perform those actions without any difficulty, without any discomfort. So your facial nerve is intact. And now the other thing I'm going to do is inspect your eyes visually. I don't see anything abnormal. Do you have any pain in them? I see you have your eyebrows. I'm going to palpate for any pain. The lacrimal gland is up here. It produces tears. I don't feel any swelling. Is it tender when I press on it?
No.
Okay. And now I'm going to inspect your conjunctiva. It's a nice pink. I don't see any discharge. I don't see any sign of trauma or redness. Just open your eyes, please. I see your sclera. I don't see any sign of trauma on it, any redness. Your lens is not opaque. I don't see any sign of cloudiness on it. And your cornea seems to be okay too. I don't see any sign of abnormality on it. And now I'm going to inspect and palpate the puncta. These are the holes where the tears drain. And normally if they are clogged and I press down like now, tears come out. in this case, they seem to be draining well, so we don't have a problem there. And now I'm going to look at your fundus, which is at the back of the eye. I'm going to shine the light through your eye to get to see the fundus. Now, okay, there we go. Okay, there we go. I see it. It's yellow, orange, and I see the optic disc. I see the veins running out of it, and I see some twisting of the veins. I see the macula. It's a darker shade of the optic of the fundus, and I don't see anything abnormal at this point. Now I have to compare this side as well. It's yellow, orange. The fundus is, I see the optic disc and the veins and the arteries running out, in and out of it. And the macula is a darker shade of the fundus. And I don't see anything abnormal at this point. And I would like for you to stare straight ahead. I'm going to look for lateral parallel alignments. So I'm going to shine a light. I just want you to stay ahead. And what I see a spot in this eye. It's in the same area in this eye. So that's your eyes are aligned in a parallel way. The other thing I'm going to do is pupillary reaction. I shine a bright light on your retina. When I do this, the pupils constrict. It works better when the room is darker, but for the purpose of this exercise, we're not going to be able to do that. Now, I would like for you to look ahead. There. When I shine a light in your face, the pupils are constricted. They constricted at the same time. That means you don't have, well, they are working okay. The other thing I'm going to do is near point convergency. I already have this. I have a letter on it. When it's farther away from you, this letter you should see a single letter. But as it gets closer to you, you may see double vision. That should be a normal finding, but it shouldn't be a normal finding if it's this farther away. So I'm gonna get closer to you. Tell me at what point you see double.
Yeah.
There, okay. So that's a normal finding. The other thing I'm going to test is peripheral vision. I'd like for you to go ahead and cover this side of your eye, and I'm going to move an object. Just tell me at what point you see that object without actually moving your face, just moving your eye.
See?
You see it now? Okay, good. Tell me when you see it.
I see.
Tell me when you see it.
I see.
Okay, that's good. Now let's do the other eye. Okay. Tell me when you see it. Tell me when you see it.
I see.
Tell me when you see it.
I see.
Okay, your peripheral vision is intact. That's a good thing. One more thing we need to do is, I think that's all we have to do. Oh, we have to do the extraocular movements. We test the six cardinal places. There are 3 nerves that control our eye movements are the trochlea, abducens, and oculomotor. They do, they move the eyes in different directions. So that's what I'm going to test for to make sure those nerves are intact. Okay. Now I would like for you to keep your head in one place and follow my finger. Well, you did great. Your nerves are intact. The other thing we have to do is, well, your vision seems to be perfect for now. Let me see if I can look anything. Okay, now I'm going to look at your ears, inspect them. If there is any visible abnormality, palpate for any tenderness of the tragus. The mastoid non-tender and the pinna is non-tender. Now I'm going to use the otoscope to check out your canal for any signs of perforation, any infections, or excessive cerumen. Your canal is clear. I can see your eardrum is pale gray. The structures by it intact, and there is no sign of perforation. I compare bilaterally. The canal is clear. The eardrum is pale gray, and the light is reflecting off of it, and there is no sign of perforation. And now I'm going to do a whisper test that tells me how well you hear. I'm going to whisper something. I would like for you to repeat it.
Okay. Sugar.
Well, your hearing is perfect. And now with a tuning fork, it's going to let me know how well you hear at the same time in both ears. So I strike it and put it at the top of your head. You hear it at the same time. Okay. So your Weber test is good. Your hearing, lateral hearing is good. The other test I have to do is the Ryan's test. It tests bone conductivity to air conductivity. We want the air conductivity to be greater than the bone conductivity. So what I'm going to do, I'm going to strike it, put it on here, and it should be that you hear it before it gets to the ear. Okay, that's a good sign when it happens that way. The other thing we have to do with your ears is we did a whisper test, which tests your gross hearing. That was good, and I think now your ears don't have any problems. And now we're going to do your nose. I can see it's symmetrical, it's midline. I'm going to test for patency. I'm going to close one nostril at a time, and I want you to blow out and in. Okay, that's patent. That nostril is patent as well. Now I'm going to look inside your nose to see the mucosa is nice and moist. I don't see any septal deviation, and I don't see any perforation. And I'm going to palpate for any pain. Do you have any pain here? You don't have any pain? Okay. Now, I would like for you to close your eyes. I'm going to let you sniff something, and I would like for you to tell me what it is, okay? Tell me what this is.
Alcohol.
Good. What is it?
The same.
Okay, good job. Your sense of smell is good. That's your cranial nerve, olfactory nerve that controls smelling. And I can see you don't have any mucus in your nose at this time. You don't have any problems with your nostril. And now I'm going to palpate your sinuses. This is the maxilla sinuses. Do you feel any pain here? Do you feel any pain? And now your frontal sinuses. You don't feel any pain here? Okay, that's good. Now let's go on to your mouth. Okay, I don't see any lesions on your mouth. Your lips are smooth. I don't see any cracking or discoloration. Now I would like for you to open your mouth for inspection. I'm going to shine this light to inspect your mouth more closely. I can see your teeth are white. I don't see any bad teeth in there, any bad rotten teeth. Your oral mucosa is moist and pink. Your uvula is midline. I want you to say ah. Okay, that's good. I can see your tonsilla, your tonsils +1. They're not really swollen. That's a normal finding. There is no indication you have any infection at this time. I would like for you to stick your tongue out, please. Move it from side to side. Say light, tight, dynamite.
Light, tight, dynamite.
Okay, that's good. Your hypoglossal nerve is intact as well. And your palates, let me look at your palates to make sure you don't have any lesions on them. There is no sign of infection, which is good. Can you lift your tongue up for me? I'm looking for any abnormality, which I don't see. Okay. Now we did the light side and inspection tonsil. Now I'm going to look at your neck, your structure, your trachea is midline. I'm going to palpate the carotid artery. I'm going to do it bilateral and compare. Okay, that's good. That's good too. And I'm going to osculate it. Okay, it's doing good. Okay. Well, it's really normal. Okay, and now we're going to, I would like for you to lift your shoulders up. Okay, alright, that's good. I would like you to turn your head from side to side. Okay, this is a test for the cranial nerve, for the shoulders, and it's, you're doing great. I'm going to raise the bed for 45 degrees and check for jet. Okay, 45 degrees, here we go. Lay back for a minute. I'm going to inspect for any, bulging of veins, which is the JVD. This area is nice and flat, so there is no distension of the JVD. You don't have fluid backup. You don't have right side heart problems that would manifest, with a distended JVD. Okay. Now the other thing we are going to do is, I would like to look at your stomach. Okay, I'm gonna look from your right side to tell whether it's flat or a little bit not flat, like round. Okay, from here I can see it's a little bit round, and when I use a light to shine on it, I'm looking for alignment to make sure everything is midline. When I shine that light, I see there is alignment there. Now I'd like to look at the skin on your stomach, abdomen, to see if there's any discoloration, any scars, or any issues, which I do not see at this point. I'm going to go ahead and oscillate. I'm going to listen to bowel sounds clockwise. Have you had any abdominal problems lately?
No.
From the right lower quadrant going clockwise. Bowel sounds are audible, they're positive. And now I'm going to the upper side of the stomach to listen for a while. Okay, they're present. They are normal, they're not hyper and they're not hypo. So that's a good thing. And while I'm listening to that, I can also hear some vesicular sounds that might be coming from the aorta or the iliac artery or the renal, which all sounds good. And now I'm going to do some light. I'm going to do some light palpation in all quadrants. If you feel any tenderness, inform me. If you feel any pain, I don't feel any lumps in your stomach, so that's a good thing. Now I'm going to percuss. Usually when we percuss the abdomen, the predominant sound is tympani because of the air and the fluid. Okay. Now I'm going to percuss clockwise, okay? Okay, that's timpani there. And timpani there. Okay, predominant timpani. And normally when we percuss over a solid organ, it sounds dull. Like when we do over the liver, I'll help you sit. I'll help you sit up. Okay, now I forgot to do your bladder. I need to, I'm sorry.
It's okay.
The bladder is down here. I'll palpate it. Do you feel any pain there? No pain? Okay, I'm going to percuss it. Okay, it's timpani. Okay, I'll help you sit up. Okay, now I would like to look at your lungs. I would like to look at your chest and see the diameter, how anterior posterior compares compares laterally. The normal finding should be anterior posterior less than, you are wider as you are this. Yeah, that should be the normal finding, and that's what I see. So now I'm going to be AP to L is 1 to 2. Now I'm going to percuss for symmetry of expansion, like when you breathe. I'm going to put my fingers here, and I would like for you to take a deep breath. Okay, when my fingers come apart, that shows that the breathing is symmetric. Okay, and I'm going to do that for the back. Okay, I'm going to put that in the mid back, and I would like for you to take a deep breath. Okay, there you go. When my fingers come apart, when I do that, your breathing is symmetrical. And now the other thing I'm going to do is I'm going to put my hand on the sternum, and I'm going to say 99. I want to say 99. 99. 99. 99. 99. Okay. That was good. I'm going to do the same for the back. Okay. Okay.
99. 99.
Okay, that's wonderful. I like what that test for is for to show that the bronchi and the lungs are clear enough to transmit for air movement. The other thing I'm going to do is oscillate for. I'm going to percuss the costal vertebral angle, which is at the back. I'm going to let you stand. I'm going to do the costal vertebral angle, which is on the 12th rib, and I'm going to percuss it. Do you feel any pain there? You don't feel any pain? Okay, that's good. We're done with that. Thank you. And you wanna come back? To be able to look. And now the other thing we're going to do, I'm going to listen to breath sounds. Okay, the posterior and anterior. I'm going to start with the front. Okay. Take a deep breath. Okay. Okay. Okay, I didn't hear your breath sounds are clear. I didn't hear any wheezing, any bronchitis, or anything that's not supposed to be heard. And now I'm going to listen to your lung sounds from behind, posterior. 5 minutes.
Mm-hmm.
Okay, there we go. Take a deep breath. 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 Okay, your lung sounds are very clear. And now I'm going to listen to your heart sounds. I'm going to start with sounds. Percuss lung fields. Okay, I need to percuss the lung fields. I'm going to start with the back. Okay. Yes, sir. Okay. Depending on what area of the lungs it is, if it's the bronchial. Okay. Now I'm going to listen to your heart sounds. Okay.
Mm-hmm.
I'm going to start with your upper extremity pulses. This is your radial pulse. It's regular, it's normal. This is your brachial pulse here. It's regular and normal. I compare bilaterally. Regular and normal. Regular and normal in both arms. And now I'm going to palpate your carotid as I listen to your apical pulse here. Okay. Well, it sounds good. Normal rate, and I'm going to listen to your aortic, which is on the second intercostal area, and then on the left is your pulmonary. Okay, and then at the left sternum, just below the pulmonary, we have the abs point, and then to the left of the left of the sternum is the tricuspid, and then near the mid we have the mitral, and they're all sounding good without any breaks or any abnormality. And now I want you to touch your digits. I'm going to do the nervous system. Touch your digits. You can do that. I want you to clap your thighs like this. Okay. I want you to touch your nose. I want you to touch your nose and my finger like this. Keep doing it. Alternate hands. Okay, and now this is what we're gonna do. I want you to get up and walk on your feet. No, walk on your heels. Walk on your heels. Walk on your toes. Okay, kindly walk with your foot, one foot. There you go. That's good. Now I want you to close your eyes and stick your hands out. Close your eyes. That's your Romberg sign. You don't have any deficits. And the other thing we need to do is I would like to test your muscles for strength. I would like to test your muscles for strength, your range of motion. Range of motion in your arms. You have any pain in the swelling? Mm-mm. Okay, your gait is good. What about your spine? It's nice and straight, curved like it's supposed to be. Now your reflexes, your patellar reflex. Okay, when I hit your knee jerked. That's a normal finding. Now can you lay back and I guess your other. This is your plantar. Okay. Let me see your. Well, that's not a reaction. So your the reflexes are doing great. And now, that's it. Thank you.